Hi friends, this is Dr. Rajeshwari Reddy. I am a senior gynecologist and an obstetrician from Hyderabad. So today we will be discussing about the second trimester of pregnancy. The second trimester consists of the 4th, 5th and the 6th month, which will be 14 to 27 weeks of gestation. This is supposed to be the best period of pregnancy. This is because all the troublesome symptoms that you had in the first trimester like nausea, vomiting, giddiness, morning sickness, indigestion, all these symptoms start receding and patients start feeling much better. They feel like they are coming back to their pre-pregnant state. The appetite slowly increases. Patients start gaining weight and the troublesome thing of passing urine repeatedly, that comes down. The acidity problem also comes down slowly. Patients start feeling less tired. The fatigue also comes down, so they are able to comfortably move around. The strong sense of smell and taste that they would have while something was being cooked in the kitchen or at other places, all those symptoms come down, so they become much more comfortable leading a normal, healthy, pre-pregnant kind of life. Also, I see mothers getting very excited when the tummy starts showing. So up to 3 months of gestation, the uterus is a pelvic organ. So the tummy doesn't keep increasing. But after 14 weeks, the tummy slowly starts increasing. And by the end of the second trimester, which is the 6th month, the height of the uterus is about the umbilicus. Also, another most exciting part of pregnancy, which is perception of the fetal movements, starts from 16 to 18 week onwards. For first time mothers, it might be a little later, as in 18 to 20 weeks or even little more than 20 weeks. But for people who are pregnant for the second and third time, they perceive fetal movements a little earlier. So the fetal movements first appear as just a flicker or just a butterfly kind of moment, which gradually keep increasing as the pregnancy proceeds. The average weight gain during pregnancy is about 11 to 14 kgs from the first trimester to the end of third trimester. But usually in the first 3 months of pregnancy, patients tend to lose 2 to 3 kgs of weight, but gradually start increasing their weight from the 4th month onwards. So the average weight gain is about 2.5 to 3 kgs per month. As the weight gain increases and as the tummy starts growing, people also get a little conscious about the stretch marks that start appearing on the tummy. These stretch marks appear because of the overstretching of the skin, whereby the collagen fibers of the skin break up and leave a scar. There's nothing much that you can do to avoid these scars. Of course, a moisturizer and something as simple as virgin coconut oil or olive oil can be used for moisturizing, or certain cosmetic creams also can be used, but they are not of much use in preventing these stretch marks because this depends on the quality of the skin of the person. There is also a linear dark line which appears from below the umbilicus to the pubic symphysis. This is also called as linea nigra, which is very common in pregnancy. Apart from this, there are also certain breast changes, which is breast enlargement. The breasts become more sensitive. The area around the nipple becomes much more enlarged, and small pimple-like boils appear around the areola. As the symptoms of pregnancy improve during the second trimester, we ask patients to start doing yoga, stretching exercises, or walking. Now coming to the baby changes that happen during the 4th, 5th and 6th month. The baby grows at a much faster pace in the second trimester. In the second trimester, all the organs of the baby are functional. The heart is functioning, the lungs are functioning, the kidneys are secreting urine, the baby is swallowing, and the whole gastrointestinal tract is motile. The baby also starts to hear, and we can make out that the baby is very sensitive to the sounds like music and very receptive to maternal voice. So In some studies, it has shown that whenever the baby hears the maternal voice, the heartbeat of the baby goes up. The skin becomes more well developed. There is appearance of hair on, as in eyebrows and eyelashes. There is also eyeball movement within the eyes. And when we see on ultrasound, we can see the well-formed baby just like a miniature picture of a small baby. So now coming to the medical part. So if you have missed the double marker in the first trimester, then you could go for a triple marker between 14th to 15th week of gestation. And if you missed the triple marker also, then you could take up the quadruple marker between the 15th and the 16th week of gestation. Then there is one important scan, which is the Tifa scan. Tifa scan is ideally done between 18 to 22 weeks of gestation. Tifa scan means they see the baby in detail, as in seeing every organ. When they see the heart, they see all the 4 chambers of the heart, the lung, then the kidneys, then the stomach bubble. So it's a very detailed scan where even the fingers of the hands and the legs are seen. All major anomalies are mostly ruled out in the Tifa scan. Certain cardiac anomalies are more pronounced between 22 to 26 weeks of gestation, because of which we will get another scan done or a fetal echo done at a later stage apart from the Tifa scan. We also do a glucose tolerance test, ideally between 20 to 24 weeks of gestation. If a mother has had diabetes in her previous pregnancy, or if there is a family history of diabetes, then we can also do the glucose tolerance test a little before 22 weeks of gestation. There is only one immunization that we do in the second trimester, which is the tetanus immunization. We give 2 injections of TT, which is 4 to 6 weeks apart. In the second trimester, we ask patients to visit the doctors once in a month. In this visit, we look for the blood pressure of the patient, weight of the patient, pallor, and on local examination, we look for the height of the uterus, and through the Doppler, we can also hear the fetal heart sounds. After complete examination, we prescribe iron and calcium with vitamin D3 medications. If required, we also prescribe multivitamins and protein supplements. If the patient has any additional comorbidities, as in hypothyroidism or diabetes or hypertension, or if the patient has been on ecosprin, then all those medications of course will continue through the second trimester. We also advise patients to have a healthy lifestyle, eat healthy food, use high fiber food so that they do not face constipation, and eat small multiple meals at regular intervals, not to sleep soon after eating, to walk around a little, and have 6 to 8 hours of uninterrupted sleep. The sleeping position is not of much importance in the second trimester. Only in the end of second trimester, we ask the patient to sleep in a left lateral position. Otherwise, the sleeping pose can be as it is comfortable to the patient. Many patients complain of a nagging backache during the second trimester. This is because as the tummy increases, the weight of the tummy is falling forward, because of which the muscles get pulled forward, and because so there is a stretching nagging pain. Sometimes some patients also complain of lower abdomen pain on the side. This is due to the pulling of the round ligaments. The round ligaments attach the uterus to the sides of the pelvic wall. So as the uterus stretching of the round ligament gives a dull aching pain or a shooting pain on the sides of the lower abdomen. There is nothing much to worry about these aches and pains, because patients can take paracetamol tablet if it is unbearable, or they could take some rest and use comforting pillows. In the sleeping pose, when the patients are sleeping to their sides, they can have a pillow between both their legs, or they can put a pillow on the side and put the upper leg on the pillow. In this pose, most patients have relief from backache and they feel much more comfortable sleeping. This finishes the second trimester of pregnancy. Most of the patients tell us that their second trimester has been very uneventful and very comfortable, and as the pregnancy proceeds, we prepare them for the third trimester. Every patient's experience of pregnancy is different, and even in the same patient, the experience of the previous pregnancy and this pregnancy may also differ. But in most cases, the second trimester of pregnancy is called the golden period of pregnancy with the least trouble during pregnancy. Thank you.